So, hey, it's on the back.
No, that's,
Oh, we're doing public comment.
yeah, no public comment.
Hi, can you hear me?
Yes, but you're not on just yet.
Hang on. There, can you hear me now?
Yes.
Okay, great.
Okay. Well, you're not on just yet, okay?
So there's confusion, public, you're in the public comment item, correct?
Yes, the second item, sir, citizens comment here.
There are no people saying
Okay, all right, thank you, sir. There's no citizens coming at this time, so we'll go to the third item. Paso VA Health Clinic update is on the line, ma'am. El Paso VA, are you on the line?
That's not her.
at this point they are not online. So VA here,
No.
if you can go on to the next slide, maybe let's.
Okay, maybe I'll show up later. El Paso County update, Veteran Assistance Program, Antoinette Hunt.
Good morning, Antoinette Hunt, Veteran County Service Officer. I just want to go over a couple of things. On the 28th of July, there's going to be several county resolutions for veteran organizations. I haven't sent out the formal invite yet, but that'll go out on Monday. And I'll include Mr. Jackson and Luther so we can share it with the VACs. I would love it if you guys were able to support. Those resolutions are the UAVO, the United American Veterans Organization. American Legion Post 36 is turning 105. The Military Order of the Purple Heart will receive a resolution on that day. And the last one is the Armed Forces YMCA. So that's several at Commissioner's Court. Commissioner's Court starts at 09:30 on Monday that day, and the resolutions will probably run from 9:30 to about 11. So I welcome you all to join us on that. The other thing I wanted to talk about and just kind of float this idea out there, I get from Texas Veterans Commission the list of Texas state legislative items. So I got the list of everything that was approved concerning veterans this year. And I also got the list of everything that made it to the floor but wasn't approved or ratified during the session. And I had a meeting, I spoke briefly with Senator Blanco and Joe Moody and that group because they were at Commissioner's Court. And I asked them what happens to this legislation if it's introduced and not passed. And they said that someone has to bring it back. So now we have the daunting task of going through this legislation and seeing if anything in it affects our veterans and it's something we're passionate about, so that way we can reach out to our state representatives and ask them to get back on it. So I just wanted to bring that up because I think that's something that the VAB and the VAC and the county and the city should do collectively. I know that that's something that you have to discuss probably with Luther and the city, but I just kind of wanted to throw that out there because if we're going to do that, we need to kind of get on the ball. The last thing I wanted to announce is our grant from Texas Veterans Commission for Financial Assistance has been approved and awarded by Commissioner's Court. So we are in full fledged with the grant. The grant covers rent, mortgage, utilities, phone, and car payments. It takes all 6 branches of service and any level of discharge, veterans, family members, and also surviving spouses. So if you see people out there with a need, and there is a need right now, please send them our way because we want to help the community with that. Pending your questions.
Anybody have any questions for Antoinette Hunt at this time?
I don't have questions, but I do want to support the what Ms. Hunt said about working on legislative priorities, because as a committee, an advisory committee, that's something we should be informed of, and we haven't been. We haven't been informed of legislation that's been introduced that would support service members, veterans, and their families, and/or the status of those legislative items. So I'd like to know, Mr. Martinez, correct? If that's something that Luther and Paul can start doing. I know our legislative session just ended, but going forward, is that something that we as a committee can start getting on top of legislative priorities?
Absolutely. So our team does provide updates on state and federal legislation. And so we are set to come before council the first.
Sorry.
Thanks, Laura.
So absolutely, we can definitely support you with that information. Our team already does legislative analysis for state and federal updates. So whether it's the 89th legislative session, the special session, or the big beautiful bill, we do cover it. And we're happy to work with Paul and Luther to develop the content that you're looking for, and just make sure that it gets introduced to this committee on a regular basis, or emailed out to you if you're looking for more frequent updates.
Yes, that would be helpful. And with that said, if I'm tracking what's on the city's website, is there were some priorities city council did approve,
Yes.
correct? And I'm not tracking that very many of those did get passed in the state. So that would be awesome to start with, is what did get passed.
Absolutely. We'll make a comparison on what was on the legislative agenda and what passed and what didn't pass, along with a more broad overview of the city's priorities, so you're familiar with the context.
Perfect, thank you.
It's my pleasure.
All right, Mr. Chair, from the Veterans Advisory Board for the county. Starting 15 August through 30 September, we'll be taking applications for the new Veteran of the Year. And we are not replacing the last one. She is the one and only. But, you know, like I said, everywhere I go, I see Veterans of the Year doing God's work and representing not only the county, the city of El Paso, but the veterans they serve. Also, as we continue to serve the veterans in our precincts with our commissioners, we are going out there with our commissioners and identifying those gaps in services and bringing them back to the county, and we'll share those with the VAC as we continue to serve veterans. Looking forward to assist in identifying the homeless veterans with the City of El Paso Veterans Advisory Board. What do you want me to do? It's not on?
Hello?
There you go.
All right.
He needs to talk to the mic. Just talk to the mic instead of sideways.
Okay. I will talk to them. I am Mike, though. All right. We look forward to assist the city VAC in identifying the homeless veterans out there. I'm having a lot of folks come to me wanting to volunteer with that effort. So I'll begin with the city and to see if there's any additional training required. So when folks go out there, they're representing both the city, the county, and taking care of our homeless veterans. Also, the Veterans VSO and the Veterans Capital USA, though we are parallel efforts, we are one team. We are dedicated to serving the veterans out there, and we look forward to continue to work with the city of El Paso and creating a better environment for those who serve this great nation.
Just a second. Before you move on, what was the backstop for the Veteran of the Year application submissions?
Yes, the application time is from 15 August to 30 September. 15 August, 30 September.
DeBoe Wakefield, good morning. This Friday, if you all are available, we would like to have you come out and support our unaccompanied burial. It's going to be at the Fort Bliss Cemetery. We welcome everyone, because everyone, when there's a veteran that is getting interred that has no family, we are that family. And so we would like for you all to come out and support us with that. Also, on the 23rd of July, we're having a Korean War wreath laying. That's to meet the Korean War veterans, so that we can have that part of the veterans recognized for Korean time. Also on on August the 2nd, this one is near and dear to me. I served Desert Storm, Desert Shield, and so we are having our Persian Gulf Memorial unveiling. That's going to be at 9550 North Gateway, which is The Old Glory Memorial, Flags Across America, right across from Sam's on Diana 54, or right in front of EPCC. So thank you.
Before we move over, I want to piggyback off of what she said about the unattended burial. So we have a Paso honor unit here that we actually do the 3-round volley for those ceremonies, and it's open for any veteran to join that. So if anybody want to join that, just get with me or Shalia at the Veteran One Stop and see if we can have some more members join the honor unit, so we can actually honor our veterans the way they need to be honored before they leave here. Anybody have any questions? It's going to be Friday, but Friday 9 o'clock is the next one, but they have them more often than most.
Oh, there we go. Good job, James. All right, so I want to go back to the VA. I know this wasn't brought up yet. On the 26th, they will be doing their back-to-school Vet Fest. There will also be a car seat event along with that Vet Fest. So everything will take place from 10 to 2. Make sure that the families bring their kids, get some free book bags and some stuff to go to school, and possibly get new car seats as well. That's all I have.
What's the location for that?
Say again?
What was the location again?
Oh, at El Paso VA on Piedras.
Donna?
Yes, for community events coming up
But
on the,
just a reminder, we do have it on the
Yeah.
agenda for events,
okay.
and we haven't gotten there just
Yeah.
yet.
Okay.
So before we skip ahead.
Okay. All right, next item, the community updates from White Acres Assisted Livings. Excuse me, I skipped one, excuse me, I'm sorry. It's supposed to be Kimberly Henry from the National Organization for Victim Advocacy.
Ms. Henry, can you try sharing your screen if you have your presentation with you?
Yes, I do. Can everyone hear me okay?
Yes, ma'am.
Yes.
Okay. All right. So they shared with me I have about 15 minutes. So I'm going to kind of provide you a brief presentation. So I just want to thank you for allowing me to join the meeting early and share about really listening on all the incredible work that you're doing and all the activities and support that you're providing to veterans and to their families. Thank you for doing that as a veteran myself. So I want to share a little bit about myself and my organization, which I'll do throughout the slides. But I was asked to come today to talk about specifically the project that I work on and the agency that I work for, which is the National Organization for Victim Advocacy. And the National Organization for Victim Advocacy is a national nonprofit that provides support for direct service providers who support victims of crime and crisis, and not just necessarily crime like domestic violence and sexual assault, but also crisis. We even have a crisis response team that trains communities on how to respond to crisis. And also the team responds to crisis themselves. They responded to Kerrville and set up the Family Response Center there in Kerrville, and they've also responded to things like the Uvalde school shooting, the Pulse nightclub shooting, and things like that. But we do a lot of different projects. We have college campus projects, military projects. We credential all of the sexual assault victim advocates in the Department of Defense. We developed projects and programs for the DoD, but NOVA does a lot. We do not help victims of one-on-one of crime and crisis. I say what we do is help the helpers. So we help organizations and communities and social workers and agencies who are there, like yourselves, on the ground, supporting communities, supporting victims, supporting veterans, supporting populations, marginalized populations, one-on-one. And so we do have funding as a nonprofit through different grants, through different donors. But specifically, the one that I work on is titled Advocating for Military Connected Survivors of Domestic Violence, Dating Violence, Sexual Assault, and Stalking. It is a project that's currently funded through the Department of Justice, Office on Violence Against Women. Let's see if let me go to the next slide. There we go. We currently have 2 team members. Here on the top is Dr. Ava Ramirez-Ine. She is the Senior Military Coordinated Community Response Program Manager. She was in the Marines for about 8 years. And then there's myself, Kimberly Henry, and I'm a licensed Master Social Worker, which essentially means, again, I don't work directly one-on-one as a social worker. I focus on policy and programs and developing them. I served 10 years in the Navy, deploying 3 times. Once I was in Yokosuka during the tsunami, and then twice in the Gulf. This project, when you hear military, of course, all of you have a lot of knowledge and experience talking about veterans and the military. A lot of times we hear military, we think of combat service, sometimes mental health, deployments, transitions, transferring, getting out of military service, the uniform, the structure. Those are all terms that we really think of. And when we have longer presentations, we actually ask the participants what they think of when they hear the word military. And those are the common terms that we get, and honor and service and dignity and respect. But what we don't hear a lot of is domestic violence and sexual assault and stalking. And when you hear military connected survivor, a lot of people think of survivors or living survivors of people who were lost in combat. Not that those individuals are not important, but this project specifically is actually the only one of its kind, where when we're talking about military connected survivor, we're talking about any of the individuals on the screen who are survivors of domestic violence, dating violence, sexual assault, and stalking, or what's called DVSAS, which is a term through the Office on Violence Against Women. Some people know DVSAS as domestic violence and sexual assault services, but again, DVSAS is just an acronym for all those different forms of violence. You'll see on the left-hand side, when we think of military as well, we think of the active duty, the National Guard and Reserve, veterans, and civilian dependents. But on the right-hand side, we are talking about intimate partners as well. Why? Well, as you know, working with veterans especially, intimate partners do not qualify for a lot of the different programs and services that are given to veterans or active duty service members or anybody that's on the left-hand side. And why is that important? Well, as you see, an intimate partner is someone who shares a social relationship or of romantic nature, or shares a child, or is a current or former spouse, or shares a home. Why does this matter? Because if you can imagine working with a veteran and maybe they share a child with somebody and one or the other is experiencing domestic violence, that intimate partner does not have access to resources because they're not a dependent, and that can create a lot of challenges. So the mission of our project, because we're grant funded, we provide free training and technical assistance, which is essentially consulting for communities, for service providers, for law enforcement, legal professionals, victim advocates, social workers, healthcare providers. I just trained some sexual assault forensics examiners on what military-connected survivors need. When you are a victim of domestic violence or sexual assault and stalking, you have certain experiences and certain trauma. But then when you add the layer of being connected to the military, it adds a lot of different unique barriers and challenges. And so this project trains these different populations, like I said, the legal personnel and the advocates and law enforcement, on what it means to be military connected and to be a survivor. I'm not going to go through all of these, but in our longer presentations, we talk about these different unique dynamics and challenges. When I was providing a presentation to the sexual assault forensics examiners, they mentioned that they had a victim come in and to the emergency room. It was a female, and she said, "I just want a sexual assault forensics exam. She was just assaulted." And she said, "But don't call anybody." She was active duty. She said, I think her spouse was a veteran, and she said, don't call the base, don't call the VA, don't call law enforcement, don't call base law enforcement, don't even call the base victim advocate. Do not call anybody. I just want the exam. I want the DNA taken. I just don't call anyone. Even though there was a lot of violence involved in that assault, she did not even want a victim advocate. Why? Because of a lot of the challenges that come along with being military connected. There was a fear of retaliation. There was a fear of impacting the benefits for that veteran, that their spouse had just got out of the military, was transitioning into being a veteran, was trying to get a job on the base as a DoD civilian. She didn't want to mess up his career. So many different aspects impacting because that person's military connected. There's a camaraderie and the family bond, the impact of PTSD and that fear of not wanting to impact the VA benefits and that veteran's mental health. And that the veteran was a spouse, not even the victim of the sexual assault. So we talked about these additional layers of challenges for these military connected survivors. We also help communities, again, law enforcement, legal personnel, victim advocates, agencies like yours, build coordinated community response. It sounds like you all work together already, which is great. Operating in silos does not work well. It is not efficient, but coordinated community responses, a lot of times you might have like a mental health response team or a military response team or a sexual assault response team. What a coordinated community response team is really bringing them all together and identifying in the community, who's the best point of contact if this situation occurs? Who's the best point of contact if this occurs? Who enforces a military protective order? Who enforces a civilian protective order? What MOUs can we write? What can the VA provide? When is law enforcement contacted? Who is the best legal person to contact? We have a victim of sexual assault or domestic violence. Who can get on base as a victim advocate? The VA calls it IPV. Well, what services can they get when it's, the DOD calls it domestic abuse? And honestly, the VA and the DOD actually have different criteria and definitions. So that creates additional barriers. And so it creates this coordinated response. So when something happens, everybody already knows what to do and how to do it. So when I say that what we do as a project is provide training and technical assistance, a lot of that is done not just through a lot of webinars. We do a lot of webinars, but we develop a lot of tools and resources. Here are some examples of some of the custom training topics. We don't just come up with these out of nowhere. This is through research that we've done. Obviously, our military experience being victim advocates, both Ava and I were victim advocates while we served. And then also I was one as a DoD civilian as well after my military service. But also through working with communities and agencies like yourself or victim advocates contacting us. For example, the one here in the middle that says housing considerations. A Georgia domestic violence shelter contacted us and they said, hey, we have some, victim advocates who aren't in the military. They don't have access to base, but we have some victims who come from the base and they leave. They finally get out of their abusive situation. It was a very highly populated base. And they said every once in a while, we might get a victim that comes to get help from us, but they want to go back on base and get their stuff, but we don't want to just send them back to base by themselves. It's not safe. So how do we get on base to help them? They're not going to let us on base with them, but they don't want to report to the base. They don't want to make a report. So what do we do? And I said, that's actually a great question. So I developed a training on the difference between on-base and off-base housing and the different policies, as well as the rights to housing allowance, because spouses do have a right to housing allowance, even if they're not active duty, and how to coordinate with the on-base victim advocates so the victim can still get their belongings if they need to, or go back on base and really just get help without having to make a full report and still be confidential and not getting law enforcement involved. Because honestly, NOVA, we actually, again, credential the victim advocates in the DOD. So it's not necessarily that the victim advocates in the military aren't good, but there's a lot of reasons because of those unique challenges of being in the military or connected to the military. There's just a lot of reasons why people, victims, survivors, go out in town to report their abuse or report their experience and just seek outside help. And so it's trainings like these that will ensure that organizations, agencies, advocates, individuals like yourself have the training and the resources that they need. We also have partners like the National Crime Victim Law Institute. They are lawyers and they are very, very smart, and they do very long, sometimes very long trainings with a lot of legal terms, but they break down the military criminal justice system and the ins and outs and the loopholes, and so we have them provide training at times. We also do trainings on like the veteran treatment court process. I actually am, we're about to release a 3-part training series for free on the veteran treatment court that you all, if you'd like to attend, you can. Because veteran treatment courts are there to help the veteran offender, there's debates on if veteran treatment courts should even hear domestic violence and sexual assault cases, because if the victim is the domestic violence and sexual assault victim, and the veteran treatment court is there to support the veteran, then where does that leave the victim? And so there's been debates about that. So the training is going to talk about the findings and the work that we've done, working with veteran treatment courts, as well as some plans and ideas and strategies. So you can attend one or all 3 of those. We've done fatality reviews and how military service has impacted domestic violence and fatality cases. And then, of course, how to work together as a team in your community. And then we developed some toolkits. This is a self-assessment. I've been at NOVA technically for a little over a year, but I've been credentialed with them as a victim advocate for 12 years and been a consultant for them for a couple years now. And since coming on board full time, something I always ask is, how prepared are you to support military connected survivors? Working with veterans, I'm sure you have all seen that poster that has a male veteran. You know, he has his military top off, he just has a t-shirt, and he's got his camouflage pants on, and maybe his boots untied. He's got his head down, sitting in a chair in a dark corner with beer bottles around him and maybe, you know, a gun in his hand, and just looks depressed and sad. And, you know, the poster says, "We're here to help you." Like, you've probably seen a poster like that. How welcoming is that poster? If that poster is in an office, how likely is a veteran who sees that poster, how likely is a veteran who's struggling, how likely are they to actually go get help from that agency? Probably not very likely. They don't want to be seen as that. They don't want to be that stereotype. And so this organizational self-assessment, especially if they're a victim of domestic violence or sexual assault or stalking, because a lot of times that it's associated with combat. And so if you're a victim of violence, you kind of start to minimize or dismiss your experience because you're like, well, at least I didn't go, you know, my trauma's not from combat. Like, well, at least I didn't lose anybody. At least I wasn't in a Humvee, you know, explosion. So I guess my experience isn't that bad. And so that keeps people from getting the help that they need. And so what this organizational self-assessment does is it asks you, how prepared are you or your agency to support military-connected survivors of domestic violence or sexual assault or stalking? And so it's really just a work through with your team to ask that question and answer it. And then if you identify gaps, then you contact us and say, hey, we realize we're not very good at this. Can you help us? And we provide that help for free. This is a guide to help develop, but again, it sounds like you all do great at teamwork, but this is a guide to help build teamwork as well. This is a report that we did on veteran treatment courts after communicating with veteran treatment court judges and personnel. You can review it, but ultimately we're here to help. Again, it is the only project of its kind. We don't train the Department of Defense. Again, we do have DoD contracts and projects here at NOVA, but this project is for community advocates. It's for civilians. It's for agencies, communities, organizations, legal personnel, law enforcement, because we know, and there's data that shows it, but we know that not always will military-connected individuals go to military or VA agencies or helping agencies or offices to get help. A lot of times they do go off base or outside the VA, and we just want to make sure that military-connected survivors do get the support that they need. And so we're here to train on that. We're here to provide tools and guides and to answer questions. And also we're here to help push for research and policy. There's not a lot of research into stalking in the military. If you look, there's not a lot of data on it. There's not a lot of reports on it. We also have another training webinar series, 3-part series on military and stalking, and I'll send that in a follow-up email. That's for free if you'd like to attend as well. And then this is our website, our contact information. We do have a new website coming. I call it the Centralized Resource Center because it does have recorded webinars and a lot of more of our toolkits. We have templates for MOUs. We have a guide that explains military protective orders and civilian protective orders and how they work and the challenges with those and how you can have law enforcement agencies work together. But again, at the end of the day, we're here to support agencies like yours. I live in St. Angelo, well, Cristobal, but right outside of St. Angelo. So I'm not too far, but being here in Texas and having access to national resources, my goal is to help expand the conversation around veterans, the military connected community. I did have a service dog. She recently retired. Our picture is actually at the Big Spring VA. But the first question that I always got was, were you in the military? And the answer was yes. And the second question always was, were you in combat? And I speak publicly about that at conferences, both for NOVA and then on my personal experiences. And yes, I was in combat. Again, twice in the Gulf. We dropped a lot of bombs on ISIS. And I was, like I said, in Japan during the tsunami in 2011. But I also experienced my own trauma in the military and faced very extreme retaliation following my report. And I know that that's not the image the military wants. I had some incredible experiences. I lived in Hawaii. I got to spend a week in Australia on my birthday, coming home from a deployment. I learned a lot. I have a top secret clearance. There's so many cool things that I get to say, so many incredible missions that I got to accomplish. Lifelong friends. There's so many things that I'm proud to say that I'm a part of being in the military. But I also know there's other realities as well. And at the end of the day, the goal is to help ensure that if people want to get help for whatever trauma that they've experienced, if they've experienced trauma, that there's no wrong door, that no matter where they go, that they get help from people who know how to help them. And this project does that for free. So I'll stop there and ask if anybody has any questions.
Do anybody have any questions at this time? For
I
Kimberly?
always do. Hi, Ms. Henry. So of course, I received this briefing just yesterday with the Women's Commission, but I wanted to inform this committee and anyone watching that one thing Ms. Henry pointed out as a gap in services in West Texas is pro bono lawyers who can provide these types of services for military-connected survivors. I don't know exactly how we go about closing that gap, but I'd love to talk with you more later, Ms. Henry, about that. And then my question for you, Ms. Henry, is are you connected with any of the Fort Bliss or El Paso VA leadership?
I haven't been connected yet, which I would love to be connected if that would be great to be connected with them. If you can, connect me with them. And what she's mentioning about the lawyers is, if you were to, a victim of domestic violence or sexual assault in the general community, who would you contact as a lawyer, right? That's a hard question to answer. And then if you're military connected and you're a victim of domestic violence or sexual assault, who do you connect with? Who do you contact as a lawyer? That list gets even smaller. This project connected with the National Crime Victims Law Institute. They have we have a training program where there are pro bono lawyers. They're lawyers that train, so lawyers basically can be pro bono for survivors. And so I can want to build that up in the West, really the whole Texas area, but the West Texas area especially. And so I can provide more information on that in the email as well.
Thank you.
Good. One question or just awareness. So last month, we had the intimate violence new position at the VA present. So I think that would be one, and I'll be reporting out on that today in our mental health, some of the things that they have going on in the community. So we do have that. For someone who works with a large population of active duty service members, when there's a domestic violent dispute, the referral process for the spouse is to go back to the FAP, the Family Advisory Program, and they have a clinical piece, and then they have their victim advocate piece. So your program is designed, to my understanding, for people that maybe don't feel comfortable in either one of those two environments. Is that correct?
Yeah, so the project, we don't provide direct victim care. It's just to make sure that those military-based project communities or agencies also can work with community-based agencies. So a lot of times we'll hear like the local domestic violence shelter in that case out in the community is or doesn't know or doesn't want to work with the base family advocacy program and vice versa. And so we help those agencies work together and build that coordinated community response. That sometimes there's a mindset that in the community, the military has plenty of services, or the VA, veterans get plenty of help. And that's not necessarily the case. Yes, there's a lot of programs and incredible advocates and incredible services through the VA and through the DoD, but that doesn't always mean that victims want to use those services. And so it's important to build those partnerships and those relationships. And so a lot of times, for example, at the ER, in the case of the sexual assault forensics exam, those nurses didn't know if they could not call anybody, because sometimes the first phone call that they make is to base law enforcement. What that does is that takes away the reporting options. And so in the case of family advocacy, what would need to happen is if they went to family advocacy on base, that's an option. But if a victim went to a domestic violence shelter out in town, that domestic violence shelter's advocate can say, I just want to ask, have you tried the services on base? And if not, that's okay. But I want to make sure you have all the options. We have a relationship with them. We're not going to share what you don't want us to share, but we want to make sure you get all the support that you need. And that there's already a relationship built there and a mutual respect. But then that victim has all the options in front of them. Does that make sense?
Yes, ma'am, it does. And I just want to thank you for advocating and going beyond the military and going beyond the VA, because we know that there's gaps in services. As a committee chair for Jennifer Ann's group, who supports regularly, daily, and monthly and yearly, national and worldwide, support dating violence prevention for adults and kids. I am a huge advocate, and I thank you so very much.
Yeah, of course. Yeah.
Anybody have any more questions at this time? If not, thank you so much, ma'am.
Okay. Yes, thank you. And I'll send a follow-up email with some more links and information.
And do we have, we can get a copy of that slideshow?
Yeah. Sure. Yeah.
Thank you so much, ma'am.
Yep. Yeah,
next up.
Have a good day.
Okay, thank you, ma'am. This is White Acres Assisted Living on the mic now, is it? Okay.
Yes, it
Renee?
is.
All right, thank you.
Hello, sir. I've got Micah, our regional, who will be introducing our team, and then I'll begin speaking.
Good morning. Thank you to the committee for having us today. This is a wonderful opportunity. As a grandson of a veteran myself, I really feel like this is an important work that you guys do, and really important to share a little bit about us and how we can partner with veterans in our community here in El Paso. As Renee mentioned, my name is Micah Harold. I'm a Regional Director of Operations for our White Acres community here in West El Paso. Within our campus, we have all levels of care. We have a skilled nursing facility, we have assisted living memory care, and we also have independent living, and I'll let Renee kind of speak a little bit about those. But just wanted to again thank the committee for allowing us to be here today. I'll introduce our team. We have Renee Segura. She's our Director of Sales for our Regional Director of Sales for our communities. We have Lizette Vasquez. She's our Skilled Nursing Facility Liaison. And then we have Jessica Ponce. She is our Director of Sales and Marketing for our Assisted Living and Independent Living community here in El Paso. Thank you again. I'll turn it over to Renee.
Thank you to the advisory committee for having us. Thank you to every veteran, both active and retired, for your service. We truly thank you. We are here to educate on White Acres Continuous Care Retirement Community. We are now proudly operated by OPCO Skilled Management. This facility had previously been operated by Good Samaritan, but our company has now purchased 26 Good Samaritans, and El Paso and Las Cruces were both acquired by OPCO Skilled Management. Today we'll share how our full-service senior living campus supports numerous veterans across all levels of care, with specialized services including VA contracted skilled nursing and aid and attendance assistance. I'm trying to get into this slide. Thank you. White Acres is located at 7304 Good Samaritan Court, here in El Paso on the west side. We are, again, newly operated by OPCO Skilled Management since November of 2024, and we both share a legacy of senior care with a bright new future. White Acres has served the El Paso area for decades, and with new leadership under OPCO, we're committed to expanding our commitment to excellence in senior care. Our focus remains on high quality, compassionate service, and we are backed by the experience and resources of OPCO's extensive skilled nursing and senior living network. This is a beautiful picture of our facility and pool. The full spectrum of care that we provide is starting with independent living. Independent living with services is also available to help keep our residents as independent as possible for as long as possible. Once ADL requirements are met, and if the resident decides, we can move our resident into assisted living. We also provide memory care. Skilled nursing and rehab are VA contracted, which allows our veterans to have the ultimate coverage for their skilled nursing needs. And when needed, long-term care is available. One of our greatest strengths is our continuum of care, allowing residents to age in place as their needs arise. From independent living all the way to skilled and long-term care, we ensure consistency, comfort, and dignity throughout every stage. Our VA partnership is extremely important to us, and we are proudly serving veterans each and every day. Independent and assisted living opportunities are that we would support access to aid and attendance. We will be educating all that come in to what is the wartime dates that are required to meet this pension. We will also assist in document gathering and let our families know what it takes to get started. The application navigation is something that we pride ourselves on. We'll go ahead and connect them to all of the right people to get their process started, starting with your benefits office. We have multiple agencies on top of that that are ready to assist in this process as well. And of course, we're always aiming for, and we do make sure that it is a no-cost consultation for our veterans. Skilled nursing and long-term care are also supporting veterans with their VA contracted services, which means that when we're working with William Beaumont and the case managers in your hospitals, there will be a VA, it will be a seamless VA referral process. It's very much veteran-centered, and we want to make sure that our veterans know that their coverage will be about 1 to 100 days covered at 100%, which makes it so that they have peace of mind in knowing that they're there to get better and not worry about the financials. Aid and attendance guidance is extremely important. There is a very high gap in people that know about this pension. So we're here to educate on aid and attendance, the benefits that can help cover the cost of senior living for wartime veterans and surviving spouses. At White Acres, we're actively helping our veterans and their families get started, and we want to make sure that everyone understands the pension rates available. So we want to show for the rates 2025, surviving spouses will be eligible for 1515 if they meet the criteria for aid and attendance. That pension can go all the way up to $3,740 if we have a veteran married to another veteran. And if we have a veteran married to another veteran, 1851. This is a significant part of the rate that is charged for independent and assisted living. So it will cover a majority of what they will have. And we're very unique to El Paso. White Acres remains the only full-service CCRC, again, managed by a seasoned operator, OPCO Skilled Management, with integrated services and a strong VA partnership. We offer a personalized approach, and we're proud to serve as a trusted senior care option for this region's veterans and their families. Some of the services included in White Acres Independent Living would be a 24/7 emergency response system. We also have nightly watchmen to help guard our residents and make sure that everybody is kept safe. We offer restaurant-style dining, scheduled transportation, social and recreational activities, weekly housekeeping, access to third-party care team services, and again, we're backed by the security of our full-service CCRC, standing for Continuous Care Retirement Community. Our amenities are many. We have private apartments with full kitchens, Wi-Fi, and all utilities are included. We offer optional dining services. We assist with mailbox as well, outdoor swimming and spa, which actually I've heard is the only facility in El Paso to have a swimming pool. So we invite you to our next swimming pool party, our summer bash. Thank you. And numerous walking paths around our 46-acre campus. Guys, it's beautiful. And we would love to have you come in for a tour. We also provide library, arts and crafts, and a chapel. White Acres Assisted Living, you have to have 2 activities of daily life requirements to go into an assisted living. And beautifully enough, that's actually the same criteria that is also required for aid and attendance. And so these 2 go hand in hand, and that's what we want to make sure you know, and our families know as well. So if a person requires assistance with 2 activities of daily life, then they can come in and have their 24/7 emergency response service, and they're going to also have a 24/7 licensed nurse available to them. What's beautiful is that we provide care in levels. We go levels 1 through 5, and that'll be something that is assessed by our nurse. So you only pay for what you need, keeping costs low as much as possible. We have 3 nutritious meals, again, scheduled transportation to their VA medical appointments, social and recreational activities. and much more. The amenities, again, are numerous, and we would love to have our families come in to learn and experience them, not only through tour, but also a respite stay or a guest stay. Short-term rehabilitation and long-term care. The services there are post-acute. So a person will go to the hospital and require a little bit more time to get stronger. This is where we come in. So anyone from the community that gets hospitalized and requires additional care, you can rest assured that you'll have 24/7 nursing care with us at Skilled Nursing. We will also provide a restaurant-style dining experience. We'll be providing medications throughout their 24/7 experience with us, and we have provider services like PT, OT, and speech therapy. We provide private and semi-private rooms to accommodate those special needs, and we provide Wi-Fi, housekeeping, laundry services. We have adjustable beds and salon services, activities, and transport, again, to local appointments. We are very expansive with our clinical capabilities. So again, at Skilled Nursing, we can provide services of Wander Guards, bariatric care, BiPAP and CPAP needs, IV antibiotics, outpatient hemodialysis, and yes, even hospice and palliative care. The biggest component being PT, OT, and speech therapy. We are there to get them better. And the average length of stay for skilled nursing is anywhere from 10 to 20 days. But again, with the VA contract that we have, if we had a patient who required more, the days of coverage would go from 1 to 100, at 100% with TRICARE for Life. These are the network insurances. These are in-network insurances that we accept. It's a good list, and you'll see your VA respite is covered as well, along with other managed plans like United, Humana, traditional Medicare, Medicaid, Blue Cross Blue Shield, etc. We want to partner with you. We want to partner with our community. We want to make sure our veterans know we're here to partner with them. And we are accepting all VA referrals. Tours available are walk-in, or they can request a tour by calling us, and you'll have a number provided here as well as on the brochure. So we want to support our veterans and helping them to understand their benefits, and we want to make sure that the application process is streamlined at all times. So we work with multiple community partners to ensure that. We have, again, also acquired Las Cruces Village Independent Living, Las Cruces Assisted Living, and Skilled Nursing. And so everything that we're doing at White Acres is copy and pasted over to our CCRC in Las Cruces. So if you know of any veterans that are needing more information about senior living services in both areas, we are your team to help answer those questions. We want to thank you so much for your time, and please don't hesitate to reach out to us. This is contact information for our local liaisons. Jessica Ponce, Senior Living Sales Specialist, can be reached at 915-201-0737. Lizette Vasquez can be reached at 915-493-0318. We thank you for your time. Yes, sir.
Yes, so White Acres is now 100% profit. It's no longer affiliated with any Christian entity, is that correct?
That is correct. It's privately owned.
What happened to those that were there? Are there the legacy folks that were there under the old administration?
Oh, we're very proud to say that we've maintained, retained the staff. So when we came in, it was an addition to enhance all services, but the core staff is in place.
No, I'm not asking about the staff. I'm asking
sorry.
about the residences.
Yes, of course. They have stayed. I think through the acquisition, of course, everyone gets nervous because of the change, but they have been very pleasantly surprised by the true management that OPCO is bringing. There were things that were not attended to timely, because of the lack in funds, resources. Now that we have OPCO's strong backing, strong financial backing, we have gone in and really started phasing new construction, really revamping our apartments, our halls, our amenities, our pool, Lots of great, changes where the residents have been very appreciative. Our last resident council went pretty good. We were very satisfied. Yes, sir.
2 questions, maybe 3.
Yes, ma'am.
What is the age for entry?
55 and over.
Okay, secondly, do you have a husband-wife team in the room, or how are we doing this?
Actually, we can. Yeah, absolutely. So in independent living, it's just like anyone's home, If you want to continue to live with your husband, sometimes we don't.
No, we don't. We're just asking for a friend.
No, I'm kidding. Yeah, you can absolutely live together, even in assisted living, because we do offer semi-private. And coincidentally, if a couple ended up together in a skilled nursing setting, which I have seen at least 3 times happen, we will try to put them in the same room as well.
Okay, last question. What happens if you do respite, or if you come there trying to do assisted living and you actually physically and mentally are not able to? What is the timeline to figure that out, and how much care do you provide before they're sent elsewhere?
So we have on-site third-party care teams to assist with one-on-one care if we had to figure something out, right? So maybe we had something acute occur. They ended up in the skilled nursing facility. Now they're coming back home to assisted living, and we're going to give it a try. We're going to see if this works. Of course, they'll be under observation through our 24/7 nursing team. The providers that are available on site will assist with those decisions. The family, the PCP will all assist with the decision-making. And then we can, once family agrees, move into long-term care if required. But it is not anything that we take lightly. We will go through a process and ensure that everybody is in agreement, because we want to make sure that our residents are kept safe at all times. So the wonderful addition to, and something that OPCO has brought to the table, is adding a third-party on-site care team. And that's what's allowing us to really have time to make those decisions, because with that third-party care team, one-on-one care can be available if needed.
Thank you.
Yes, ma'am.
I got a question for you. You mentioned wartime state eligibility.
Yes.
What is that? What is
Yes. The eligible wartime service dates: World War I, we have April 6, 1917 through November 11th of 1918. World War II, we have December 7th of 41 to December 31st of 46. For the Korean War dates, we have June 27th, 1950 to January 31st, 1955. The Vietnam War dates, August 5th, 1964 to May 7th, 1975. Boots on ground begins 1955. The Persian Gulf War, we have war dates of August 2nd, 1990 to present day.
Thank you, ma'am.
Yes, sir, thank you.
Anybody else?
Yes, I do. On your flyer, it says for wartime veterans, they may qualify to earn money that helps cover the cost. I'm assuming that's the pensions you were mentioning?
That's exactly right.
Okay. And
Yep,
then,
aid and attendance pension.
okay, great. And then my other thing is a suggestion. I've noticed that the veteran and the service member you had on your PowerPoint are male. I would suggest including women as well.
That's a beautiful suggestion. I appreciate
Thank
that
you.
very much.
Thank you.
Thank you. We got to get in there. Yes, ma'am.
Okay, so that's, no more questions? All right, thank you, ma'am, for your time.
Thank you all.
All right, so at this time, we're going to go ahead and back up and try to approve the minutes for May 15. If everybody have the...
Sir, at this
They were emailed to everybody, so I've reviewed the minutes already, so from my standpoint, I'm ready to approve them. I have no questions.
Motion.
We have a motion, second? All right, minutes approved. All in favor, say aye.
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 Any nays?
Yes, point of order. By Robert Rules of Order, you got a motion and a second on the floor. We now go to discussion, and then we approve it.
No, we've already done
We already done
discussion,
it,
so
yeah.
now we're taking the action.
Whole squad.
Yeah.
Okay.
All right, moving right along. Yeah. All right, so the next item we're going to discuss is the monthly updates from the VAC subcommittees. First up is employment.
Yes.
Melissa.
Yes, thank you. So Melissa Hartcrow, Chair for the Employment Subcommittee. So we did meet this month, and we did discuss some of the legislation that has passed both federally and at the state level regarding employment for service members, veterans, and their families. And we did discuss childcare. To the best of my ability, I do have the paper here. I don't want to go through every single one, but there were several. There was 2 bills, state level, regarding employment. That does include service members and their spouses, mostly related to licensing, occupational licensing. At the federal level, I did not find anything that passed. At the state level regarding childcare, there were 3 bills. Hopefully it looks like we're going to see more funding at the state level. At the federal level, the only thing I saw was with H.R. 1, the budget bill, that just talks about childcare expenditures for small businesses. The amount increased. So again, that's to the best of my ability. And then related to employment, you know, we've discussed a few times about a trades job fair. So Pride Industries, which is, you may have seen them all over Fort Bliss. They do a lot of the maintenance on post. They are hosting a hiring fair July 25th at the Armed Forces Reserve Center. I believe it starts at 10 a.m. And that's all I have.
Thank you. Anybody have any questions for Melissa?
Melissa, if I could add on to that, the one thing also for employment was for civil service employees, the hiring freeze was extended. It was supposed to end on July 15th. It is now extended all the way until October 31st, unfortunately. So that's one other thing that's going to affect employment in civil service.
Thank you.
That was good information. Next up is homelessness.
Don Brown, District 6. Yes, myself and Luther Jones, we attended the Continuum Care Governance Charter, and this is a new charter that was put back by the governance. And what it does is it assists in strategic planning. Also, it assists in organizations, because we do have a lot of homeless organizations here within El Paso. Hey, how can we get funding? How can we assist each other so all these organizations can come together as one instead of being their individual organizations? So there'll be what's now called the COIC, the Continuum of Care. So what they did was they had a board meeting. They came together, individuals presented who wanted to be on the board, and so that's what we did. Voting is out now. Myself and Luther are going to be voting in individuals we think are going to be good on that, and we're heavily involved with that. The one thing I was really impressed with on this was I'm still very ignorant on homelessness and how to really help in solving this problem. So the greatest thing I did was made huge points of contact there, and the great thing I'm able to do is actually go out with them. I'm actually going to be able to go out onto the streets, see what these different organizations do in helping these with these individuals, and then I'll be able to come back and actually have a good conversation with, hey, this is what I saw for the veteran community as well as other communities outside. How can the VA help? How can Fort Bliss assist with all of this? And so I'll be able to bring that to the board for next meeting.
Thank you, sir. Anybody got questions for Don?
I have a question. There was a meeting yesterday at the VA where they huddled, and they're going out to the streets to be able to just check with all the homeless. There was a huge number of organizations there, so afterwards I'll get you the contact so that they're going to go and look for veterans that are homeless, so that would probably be a good one to be connected.
That'd be a great one. I was not aware of that at all, so yeah, if you could hope me up with point of contact, I will be more than happy to do that.
Thank you. I will do that.
Okay. Donna, mental health.
Let's see. That are on docket. So the mental health committee, as Antoinette Hunt had explained, is there's 12 on the docket, And then there's also legislative change where our undersecretary is trying to merge SAMHSA with other organizations to be able to be more effective and reduce costs. So that's up on legislation. On August the 11th, we're going to meet and review all of these House bills and Senate bills so that we can articulate and talk and support anyone that has a need to know in that area. That's at 11:30 at El Rincon, and that's right by UTEP. But what's most important is that any veteran watching this right now, I think the main thing when you think about mental health is where can I go if you're service connected and you're signed up with the VA. And if you're thinking, well, I'm not service connected, I don't really know what that means, well, get down to your local VA because they'll get you signed up and find out if you're service connected. If by chance you're not in favor of the services there, there's 4 wonderful organizations that immediately can get you in for therapy, not necessary medication management, but I know EHN can do that if you don't have qualify. And that GI forum, that's if you're homeless. If you're homeless or couch surfing, that is a good place to go. I think it's important for any veteran watching this right now. Also, the EHN has a Veterans One-Stop Therapy, Amistad, and Endeavors. Please take advantage of these. These are sponsored many times by our local and state TVC. Thank you, Texas Veterans Commission, that support those. You don't have to wait. It's for your family members, for yourself, and it can stand in the gap. I think that's critical. We always need to reinforce that. We had a presentation earlier that was talking about our intimate partner violence and dating violence, and proud to say the VA is doing a lot in that area. I have some flyers that I'll hand out to the military program here so you can support that. But they have something, they've taken it just a step further. It's called Strengthen Homes. There's a class that will host that. They're trying to build relationships. They know that anger management, those are all offered at our local VA, and I think that's critical that you know it's there. But the Center Against Family Violence, if you don't want to go there, then they have that available. I'll make sure I give those flyers to our military chief officer and Luther so that they can get those uploaded on the system. And mental health is also about crisis stabilization, suicide prevention, trauma, getting to people when they're in trauma and in desperate places. So I know Emergence Health Network, Veterans One Stop, is having a SAVE training virtually on the 25th, and it's at 9 a.m. It's virtual, but for those that work or are not available during that hour, there is a face-to-face SAVE training. And that is how to identify, react, and respond to anyone in crisis. And the nice part is that even if you're a family member, it's still going to give you tools in your toolbox. The SAVE training on the 23rd of July is at Old Glory Memorial at 11:30 over lunch. Bring your brown bag. We're going to have pizza there, too, to offer that. Also, the American Legion is pushing hard for Be the One. That's having a battle buddy and also being able to know how to identify, react, and respond. If you're an American Legion, just go on that website, look up Be the One. And so that's also a hard push for that. There's MST, Military Sexual Trauma, for males and females. Those groups are at the VA. They have those there. A lot of times people say, I don't know, I don't have any, the VA's not doing anything for me. So those services are there for military sexual trauma at the VA. I'm also going to include that flyer so that it can be uploaded to our calendar at the city military calendar. If you don't know where that is, maybe if we can just get the email so we can let people know where to find that before we end out today. And there is, I think, yesterday I met with the VA, the chemical dependency program. Once again, they want to remind anybody, if you're walking in for detox, if you got to have an authorization, go to your local VA. Now, if you feel like you're having side effects, go to the emergency room, and they will get you cleared first. But you can't just walk into a mental health facility if you're detoxing and you really don't have any side effects. The VA will not cover that. That's important to know. You have to have an authorization or go to your local emergency room to transfer you to a behavioral health center. I think that's important because I have met veterans that get bills. That's also if you have an addictions, trauma, They have the esketamine, and they're actually starting to do a clinic at the VA where that helps with addictions, pain. It also treats PTSD. Find out what you have to do. They can get you in and see you, and it's a really great program. And so as far as, do we have services here in El Paso? Can we help support you for mental health? Yes, we do have them. And the list goes on beyond that. So see you on August the 11th for our team. And then I'm working with District 16 at the library to do a community veteran update just on all these House bills and Senate bills. I'm going to work closely with Antoinette Hunt so we can collaboratively articulate and verbalize kind of what we as residents can push our city and federal and county to get behind and be a cheerleader for. So that's it for me. Thank you.
Anybody have any questions for Donna?
Donna, I do have one question for you, and I know it takes a long time. I have a question about your app that you were working on, and I know it takes a long time to build those. I was curious, because it seemed like an awesome thing that you were building there. Do you have a status of where that might be at?
Well, there was an intern under Paul Albright, and then when it got turned over to Luther, I was asked to hold tight, and as they hired on their next intern, I don't know where we are on that, but I will get with Luther and Paul to see if they're ready to move forward, because they wanted their intern to be involved in, along with some other county departments. But I really do think that it does need to be updated and it does need to be improved, but I do know there's a process for that.
Yep.
Thank you.
I'm really excited because, yeah, the presentation you put on that, I was super excited for it. So I want to assist you on that. I'm pushing them to see if you need anything to help get that going again.
Oh, good. And on August 11th, we can bring that up too, and I'll invite Luther to attend. August 11th, 11:30, El Rincon. Mexican food restaurant. I'm not trying to do a commercial for them, but that's for our VAC. That's for our VAC mental health, and we do have bylaws that say that no more than 4 can be there. So we do have 4. Hopefully, you guys will attend, and then we'll also, after that, I think I would like this team to be able to present and be able to articulate and verbalize what these House bills and Senate bills are pushing. They're introducing them, and it's important that we as a community know how to advocate for that. Thank you.
Thank you, Donna. We're going to move to the next item, discuss and action appoint District 4 VAC member James Green to a VAC subcommittee. So we have 3 subcommittees, James. We have the employment, homelessness, and mental health.
So you want me to choose? All right, now we'll do the employment.
Melissa?
Absolutely not. No, I'm just kidding. Yes. I'd be honored to have James. Yes. It's just myself and George, so we won't have an issue with a quorum.
Okay. All in favor, say aye.
Aye.
Any nays?
I second.
There you go. You're in employment now. Yes.
Excuse me, Ron. Right here.
Okay.
I have to leave, so I'm asking for permission to be excused.
Absolutely, sir.
Thank you.
All right. Guidance for annual update to the council. You got anything, sir?
There's one update that I was hoping Paul could share this one, but currently right now he's in a flight.
Is the microphone on?
How about now? Can you?
I don't know. I'm not sure.
It's showing green for me. Is that better? Okay. So I apologize, Paul couldn't make it here. Paul and Luther, they're in a flight heading to our conference. The one update that we have for you, we recently presented our budget to City Council. This was on the 7th, about 2 weeks ago. And everything looks great. The Veterans and Military Affairs program has not reduced in size. And if anything, we are combining resources with other 2 programs, so it should be stronger than ever. No new positions for this at this point. What's important to note is that we committed to council in developing 2 strategic plans related to this committee. It's going to be city staff led, but it is a 2025 Veterans Strategic Plan and a City of El Paso Fort Bliss strategy, partnership strategy. Obviously, Paul and Luther will bring these plans for your review and consideration, but this is a dedicated effort. It comes with a little bit of consultants' participation so that we formalize these strategies. I'm happy to answer any questions regarding those.
Thank you, sir. Anybody have any questions for him right now? Okay. Thank you, sir. Moving right along to the next item. Discuss an action vote to excuse or unexcuse absence of VAC members from previous meetings. So, number one, Brian Kenoff.
I make a motion to excuse Brian Kenoff from, or make it an excused absence.
Second.
I have a question. Did any of those on the list not inform Paul or Luther that they would be absent?
Don Brown, I have no excuse for my absence. I got my days mixed up.
Okay.
And I forgot to put it on my calendar, so I have no excuse.
But he actually called me, though. He texted me, and I couldn't answer the phone, but.
I
Okay.
did, but it
You
was the day
notified
after,
Ron?
so.
Oh, okay.
I'm not going to use an old guy excuse here, but I'm a member of 4 different military organizations, and if a quorum is required for these meetings, it's not a bad idea for leadership to reach out either the day before or the morning of as a reminder, either virtually, through email, it's fine. But I find that this will maybe, doggone it, yeah, I'll be there. See what I mean? I'm just saying as a suggestion for leadership. You can take it or leave it.
All right, we'll consider that. You say you want a reminder?
I'm suggesting, well, a couple of the organizations that I'm a member of require a quorum. And if I don't know, do we require a quorum?
Yes, we do.
I think it would be important for leadership to know in advance, at least just a few hours before, if they're going to have a quorum when they meet today. That's all.
Yeah, we'll discuss that, because we can't tell if we're going to have a quorum if everybody show up, because everybody's supposed to show up. We're always supposed to have a quorum.
Well, it serves a double purpose for you guys to find out if we're going to be able to fill the seats, or for us as a reminder that we need to be there that day.
Roger that, sir. Moving right along.
We haven't taken action.
Yeah, I'm
Oh.
sorry.
Does anybody second?
Yeah, I need a second.
Does anybody second my motion?
Do we have a second?
I'm seconding it, even though I'm on that,
Okay.
list, but I did notify Luther.
Yeah. All in favor, say aye.
Aye.
Any nays?
Nay.
Okay, 9 nay. Sir? Got a nay? Brian Kenoff.
I apologize. Who was the person that said nay?
Melissa Hogworth.
Understood. Thank you.
All right, moving right along to Donald Brown. Excuse me, do we have a motion to dismiss?
I make a motion to excuse Don Brown.
Second? You gotta have a second? Second. Any nays? All in favor say aye. Aye.
Aye.
Aye.
Okay, motion excuse. And last is Donald Morris. Do we have anybody want a motion to dismiss? To excuse her dismissal?
Motion to excuse.
I'll make him, okay, I'll second.
Second. Any nays? All in favor, say nay.
Aye.
Aye.
I
All right. So right. All right, moving right along to the next item is Division Veteran and Military Affairs updates.
I will respectfully request that we wait for Paul Albright and Luther Jones to be here for them to provide the update.
Roger that, Chair. Okay. All right, next is limit to veteran affairs events. That's also you too, sir.
No, I think that's us.
Oh, you got some events? Do anybody have any
I
events?
think at that point, it usually comes to us unless you have events that you want to share.
We will make sure that Paul and Luther send out an
Okay.
email in case they have any updates for you all.
Okay. Yes, this Saturday, July 19th, 10 to 12, is our collection at the El Paso Veterans One Stop for the Women Veterans exhibit. Whether you are a woman who served or you know of a woman who served, please bring some items that you'd like displayed at the exhibit. I've received some really cool things so far, something from, I think it's from World War II, one of a deceased woman veteran who was KIA in Iraq. And so I would love to get some more items to recognize and honor the service of the women in the Paso del Norte region. And it's not just exclusive to El Paso, that's Hudspeth County, Doña Ana County, and if we have any veterans living in Ciudad Juarez, it will include them as well. The next event is July 22nd. It's a virtual VA disability claims workshop, July 22nd. It's at 1:30 p.m. and Ms. Hunt is going to be giving that presentation as well. And then August 12th is TVC Q&A. They do it every second Tuesday of the month at 11 a.m. This is your time to come and learn about what the Texas Veterans Commission does and ask any questions, and you'll get them answered on the spot, or they'll reach out to you afterwards and give you an update. So that next one is August 12th, again, every second Tuesday, and that's all I have.
Thank you, Melissa.
Yes, the different opportunities for, I'll make sure that the flyers get to the city calendar. Thank you. Oh, there's food trucks every Wednesday night from 6 to 9, and that funds are designed to go to support the upkeep of that site and repair our flags at Flags Across America. So if you come out and you enjoy an entertainment, you are also supporting our golden nugget in the Northeast. Thank you.
Thank you. Do anybody have any more events? Okay. I want to address something. If we've got the meeting, just make sure we just kind of staff our phones or put your phones on silence, please. The next event is discuss or propose agenda items for next meeting. Do we have any items for the next meeting? Well, the items for Paul and for Luther, right? Want to put that on the next agenda, sir? Okay.
Paul will send you all an email
Okay.
letting you know what he wants to propose. And I apologize again for them
All
not
right,
being
thank you,
here.
sir. Anybody have anything else?
I would like to propose the Veterans Treatment Court do a presentation that is a treatment court for mental health that supports our veterans that are entangled in the justice system, including domestic violence and other issues. So it would be nice to be able to have them present. So I will get that invite to the court coordinator and Luther.
All right.
Thank you.
Thank you. Anything else?
Don Brown, District 6. I do have a couple things I'd like to bring up for next meeting. So just to verify, these agendas are for public consumption, is that correct?
Yes, sir.
I think it would be prudent to have on the agenda all the different districts and who's assigned to those districts. So that way everybody knows, it's not guessing. One other item I'd like to also bring up, which is in conjunction with that, is for the subcommittees, not just who is the lead of that subcommittee, but all the other individuals that fall under that subcommittee. And it'll just be easier next time we have a new individual come on, we can look at and say, oh, employment only has 2 individuals, oh, unemployment has 4, so you can't be on unemployment if yada yada. So I think that would just also be prudent.
I believe that used to be the format, but I'm not sure if city council or city administration just changed that.
Yeah, it'd be good to look that up. I think it'd be prudent to put it back on the agenda like it was. Last one, I have a third one, which goes into the quorum. I think it'd be prudent, because all of us do get an email saying, hey, this is when the next VAC meeting is going to be happening. Please respond to this email. I think if Luther and Paul do not get enough responses, they should be able to see whether we'll have a quorum or not before. If they do not have that, then it'd be prudent for phone calls to be made, so that way we can have the quorum. It will also set up the fact that if you do respond to that email saying you'll be there, knowing that we'll have a quorum, and you do not attend, then that's going to be an unexcused absence, because you did say you would be there, you would be in attendance, and you missed the meeting.
That's a good idea. Anybody got anything else? Okay. Okay, next VAC meeting is on the 21st at 10 o'clock. A motion to adjourn.
Second.
I move to adjourn.
Any nays? All right.
Aye.
It's dismissed.